3, 2.
Hello and good evening, and welcome to the Littleton Board of Health meeting for August 10th. It's 7 p.m. and we will get started with a discussion on, public hearing regarding the tobacco violations and the length of suspensions for tobacco sale violations. Matt, I'm going to let you talk about this a little bit because I was not at the last meeting when it was discussed.
So I was trying to pull up the packet from that day. So basically the way it works is that the state mandates financial penalties for each progressive violation of our tobacco laws, as well as sets at least criteria for length of suspensions. So if I recall correctly, a first violation is a 1 to 7 day suspension. A second violation is a minimum of 7 days. And I believe a third violation is a minimum of 30 days. And what happens is, from what I understand, our conversations with the Tobacco Alliance is that at some point in the past, they reached out to each kind of town's Board of Health to say, hey, we would recommend these numbers. Are you okay with that? And they pretty much move forward unless they heard otherwise. So their kind of recommendation in the past has been 3 days for a first violation, I believe 7 days for a second, and 30 for a third. But that was just what they chose. And I think it's valuable for us as a Board of Health for Littleton to just discuss and decide, well, what do we think are the right lengths of time? I personally almost feel like 3 days isn't very much for a first violation. But I would like to just kind of talk about it as a group so we can land on something. And if it's what they already are using, I think that's great. But that way we can sign off on this is what Littleton does with these violations.
That makes sense. I believe Joan is going to be joining us at 7:10. So we'll keep an eye on her as a participant and see if we can get her in to catch some of this.
I presume it's Joan. Jim said that he wouldn't be here, but somebody from tobacco control would be here.
So yeah, I mean, 3 days, 7 days, and 30 days. I mean, those sound fairly reasonable. I don't know if 3 days makes an impact. Will sort of change behavior, or if it's just sort of a minor inconvenience.
So do you still have access? I don't know if I still have access to the files from the July 25th meeting. I think is where the file is.
I can probably find that.
Sorry, the 27th meeting. Was it the 20th? That doesn't make sense. It must have been before that. Be the 13th.
Is that the MGL, the law?
In the first, in the kind of the folder that the Tobacco Control Alliance, they sent us some documents that includes the posters, but there was also like a 2-pager that just reviewed what the criteria are. I'm sorry, I don't have that now. Oh, wait, yeah, there. Okay, I do have it. I'll share in a second here when I get the right one up.
Okay.
It's this one. No. Maybe they just spoke to it during that meeting.
what were your thoughts on adjusting those dates and timeframes, if any?
I go back and forth. What they recommend is if it's that first, if it's a 3-day, they do like a Friday, Saturday, Sunday as a guideline for that suspension. And I don't know. I think a piece of me, I have, as a physician, I have just a very low tolerance for underage tobacco usage. And so I would just lean towards something stiffer. Because I feel like if it's a week, then you've kind of covered every business day, and I don't know if it's who's buying their cigarettes and when, and if these businesses don't even care about a weekend, if that doesn't impact them, then is it enough of a barrier to that? At the same time, I understand that the fines are substantial, and so perhaps it's enough for us to go, well, yeah, 3 days is a bit of a short suspension, but we also understand that $1,000 is not insignificant, and that maybe that balances it out. So I think I could go either way. I would support something longer. I wouldn't support something shorter, I would say. But and then maybe for the second one, maybe that one gets a little bit longer, just because we hopefully don't see repeat offenders.
Right, and these were all first offenses. These first 3 that have come.
So no, actually, from what we were told, there was a period of time after the state law was enacted, where I think the Tobacco Control Alliance was doing reviews, but they weren't. I think they didn't have the staffing and the full process in place to actually get it to the boards of health to impose the fines. So some of these businesses did actually receive notices of violation. I think one of them had 4 before, and then they got repeat inspections and knew that they were going to get repeat inspections. And so then finally, I think in this calendar year, then those inspections triggered the fine and the suspension and the prompting to us for their request to talk to the local board.
And really, the Leominster Tobacco Alliance are really the only entity that know about all of these
Correct.
infractions.
Correct.
So
there may be others that we don't know about because those businesses don't choose to appeal to us. There was one that kind of got onto our radar and almost got to us, but then before they could come to their appeal, they apparently paid their fine and accepted their suspension, and it went away. I do feel like we should have at least an annual meeting with the Tobacco Control Alliance, just so that we can see a report from them to say, this is how many establishments you have, this is how many visits we did, here's what happened, here were the violations that you never found out about. I mean, I think it would benefit us to be informed about that.
Yeah, Gino, what are your thoughts on the timeframes for the suspensions?
First of all, we got to find out by the state, you know what I mean, to give us an idea first, and then we can declare whatever is a.
Yeah, they recommend 1 to 7 days for the first infraction, minimum of 7 days for the second infraction, and minimum of 30 days for the third infraction violation. And so currently, as it stands, Leominster Tobacco Alliance is recommending 3 days for the first, 7 days for the second, and 30 days for the third. Did I get that right, Matt?
Yes.
Okay. So Gino, we're just wondering if we want to waiver or be more strict, less strict, have a bigger, better impact as far as public health goes on setting the time frame for these suspensions.
Okay, the suspension. Okay, let's put it this way. if we find somebody missing the first one because they don't understand, there's going to be the second time and then going to be the third time. If they take care of it the first time, that means it should not be penalized. But you have to find out and make sure we send a letter to any person that feel that, oh yeah, my new young man doesn't realize what he's doing. Okay, you give him one more chance because you're going to pay for it. Let's try it this way because, there's so many, we penalize so many, the state penalize so many different things for everything. Let's prove it that we try to do the best we can, but we give them one chance. The second chance, they have to pay for it.
Well, they have to pay for the first infraction. There's a fine set out by the state of $1,000 anyway. So, I mean, I'm of the mindset. Yeah. So I'm of the mindset to not waver from what the Leominster Tobacco Alliance recommends. Keep the 3-day suspension for the first infraction with the fine, the 7-day suspension for the second infraction, and a 30-day suspension for the third infraction. But more importantly, I think the action item that is my takeaway from this is to receive an annual report or have an annual meeting with the Leominster Tobacco Alliance to see what the status of all the establishments selling these products are.
Yeah, I agree with you. The question we got
keep on the same page.
Yeah, let's see what happened, and you find out more about it. But I feel personally, somebody make a mistake because they have somebody, young man, they are 16, 17, and he wants to make some money, and he doesn't realize that he's not supposed to sell cigarettes or alcohol to a minor unless he shows the identification, how old he is. Oh, the question, $1,000, even the first time, is too much. I agree, too much to penalize a merchant that is trying to teach the young man, well, I'm not here. I want you to be careful not to sell cigarettes, liquor to anybody unless they're over 18 years old. Mm-hmm. Let's try it there. If that doesn't work, then we'll learn. $1,000 too much. I would say between you and I, maybe you disagree, maybe $250. That's going to really make them realize they have to really push it. And
I don't think we have the rates are set, Gino. It's more about just the time frame on the suspensions, the length of the suspensions that we're discussing.
Yeah, and Gino, it's actually illegal under the age of 21 in the state of Massachusetts.
Okay, 21.
These
okay,
businesses are required to have signage. The signage is provided to them. It has to be on the door. It has to be near the tobacco products. Yeah, I hear what you're saying. Some people make mistakes, but like I said, I would not want to go lower on the suspension because it's your responsibility to help protect our minors from substances that could be harmful to their growth and development. So I agree. I think, Kevin, I'm happy sticking with the certain days. I think it would help to have kind of an annual report because if fines are rampant and we're not aware of it, which I don't think that is the case. I think it's been said that we've been doing pretty well. But I think if we saw that infractions were concerningly high or increasing, then it might behoove us to then increase the suspension lengths then.
I agree. I think we need to really just stay in touch with Leominster Tobacco Alliance and some of these may be considered first infractions, but if there's been 4, over the past year that we just don't know about, and then, the counter starts over, there's a bigger issue we need to get into, talk about with them. So, okay. So we'll keep with what Leominster Tobacco Alliance recommends and suggests, and we will get an annual meeting and or report.
Would you like a motion to formally adopt those suspension lengths? Yeah.
Why don't you go ahead?
I hereby make a motion to adopt a 3-day suspension for first violation, a 7-day suspension for second violation, and a 30-day suspension for third violation of the state tobacco sale requirements, understanding that those violations all have a 36-month window to occur in.
How much money they're going to be penalized for?
The money is completely out of our control. It is mandated by the state.
Okay. Okay, I second it.
All right, we have a motion and a second. Gino Fratelloni,
Gina Ferrari, yes.
Matt Wason,
Matt Wason, yes.
and Kevin Baker votes yes. So we'll move on to our 7:10. We have a public hearing regarding Archer's mobiles tobacco sales violation, and Gary Archer, I believe, is in the audience, and we'll get him promoted to a guest now. Joseph Lantow, are you here for a specific public hearing or discussion in the audience? Raise your hand. No hand. Gary Archer is here.
Joseph, oh, he raised his hand for a second there.
Yeah. Hi, Mr. Archer. How are you?
Good, how are you, sir?
I'm doing well. So tell us what is going on.
Well, what's going on is I got the notice of the violation that occurred on back in May on Memorial Day weekend of this year. And I wanted to come to a hearing because I didn't want you to just think that I didn't care about what was happening in the community and with my establishment selling to someone. First of all, I'm pretty embarrassed of this that happened. And it's not something that I allow, and it's not something that, I would ever tolerate. It's been a challenge the last few years, as you know, with COVID. Health's been absolutely horrible to get. It's been very difficult. And that weekend in question, I actually had an employee that used to work for me. I asked her if she would come back and help me that weekend. I had someone that had to go to Florida to pick up their child. They have a case where they can have the children for the summer. So granted that, and I asked this person to come in and help me out. And the person has worked for me very often. She helps me on occasion. And unfortunately, she had an issue where she sold to a minor for the sting that you guys or that the board had conducted at my location. So for that, I'm very sorry that happened. And when I got the notification, I felt it was important for me to at least come and talk to the board about it and let them know that this is not something that I'm very happy with. And I'm certainly embarrassed of the situation. And I'm sorry for bothering, the board with infraction that covered my location. Just to back up for a second, I actually sent a letter in immediately to the board, and I checked the mail every day and I checked my email, and I never got any notification of a hearing that happened, I guess, on July 10th. Joan Hamlet actually contacted me the next day and said, "We had a hearing and you missed it." I said, "Joan, I've been looking for that meeting every day." And she said, "I believe you." And she said, "We postponed it and we'll have you join at a future date." And I did get a letter a week or two ago saying that you're welcome to come to discuss the matter with the board. So again, I apologize, but I didn't get a notification as either. So
Yeah, that's okay. I've heard that from a couple other parties.
okay.
Something was lost in the in transmission there between Leominster and some of the folks that had a problem.
Okay. I actually called up Jim Gareffi and said, "Hey, this what occurred, and I want to come in." And
Yeah.
I just think it's important not just to pay the fine and do what I have to do, but I just want to address the board and tell them that, I'm very sorry and it should have happened. Of course, it's I take full responsibility for everything that happens at my place of business. And again, for that, I apologize.
And I appreciate you coming forward here and being proactive and making a statement. And I know how much you do for the town and the community and how much you love it. And accidents happen. You're short staffed and you had somebody that, maybe wasn't didn't have their chops together as far as who to sell to and who not to. But have all the signs and informational pieces been put up, and have you notified all your other employees about the situation and made them very aware?
Yes, I have. And what I've done is I actually brought that individual, that employee in. And like I said, she only works for me on an occasion when I'm desperate for help. And that's almost a weekly thing. It's my son was on there today because we had someone out sick, and I was on there this morning for a few hours, and it's tough. And I can't find help. And it's been a real struggle. It's probably one of my hardest things I've been doing for the last couple of years. I've had a sign in my window for 2 years, and I just can't fill the spots. And I have 2 locations, and I'm doing what I can to hire the best people, but at least try to get some bodies that help me out to run the location. I since brought that person in, and I said, "This is what happened." I said, "I want to show you a video." I showed her the video. I said, "This is what occurred." I said, They didn't buy cigarettes, but they bought a tobacco product. And she's a nervous person. She says, "I guess I just didn't catch it." She bought a red sweet. And I said, "That's a tobacco product. Do you know that?" And she goes, "I wasn't thinking. And I know." And she was dumbfounded. She's like, "I can't believe that happened." And I said, "It did, and it can't happen again."
Yeah.
So I did write her up. I've got a copy of the letter. My disciplinary action that I put on her, had her sign it. We discussed it. And on top of that, I actually have put into place at both of my locations that for every tobacco product that we sell, we now card everyone each and every time, regardless of age. So without an ID, there'll be no tobacco of any kind sold. So that is now my
Great.
ongoing policy. And I've talked to everyone, and I've been on the register many times myself, and customers don't have a problem with it. And it's just something we have to do, and it's something we'll continue to do. And I have notification on my receipts if they pay with a debit card or a credit card stating that we got the date of birth, and it shows the date of birth printed right on the receipts.
Oh, wow.
That we did verify the age. So that went into place immediately when I got this letter.
Okay.
And so that's something I put in place, and we're not having any issues at all. People are like, "That's fine, we're going to stand." And it's just what we do. And we've had people before that have come in and, "I don't have my license with me. I'm sorry, I can't sell to you." And they leave, or they go out to the car and they get it.
Yeah.
But that's something I put in place, and I'm trying to do everything I can, because I do feel it's important not to sell to minors, and I take this very serious, and my employees understand how important this is to me and my business. And we've been in town for quite a long time, since 1966, and I feel we're a good member of the community, business community, and we want to do the right thing. And again, I apologize for the actions that occurred in my location, and I took full responsibility for that. So I thought it would be important for the board to know that how I feel.
That you care. Yeah, that
Thank you.
absolutely makes a huge difference. Thanks for being proactive and letting us know that, and coming before the board to do so.
If I could, I apologize. We don't have somebody here from the Tobacco Control Alliance. They usually like to kind of state things out. If you have specific questions about what transpired, it doesn't sound like it because you're putting systems in place. I really appreciate the work you've already done. We do have the letters that they sent you copies. So I do want to just call out, and I'm glad you're making the changes, because according to their records, you did have a violation in October of last year and December of last year. And that's what prompted the visit in May, was because you were on a list of repeat violations. So this is one of those, you are in a fortunate situation, because had things been running properly last winter and fall, this would be your 3rd violation, and you would be facing the $5,000 fine and a 30-day suspension.
Okay.
So I appreciate your work. I hope it works. I hope people got it now, because moving forward, it's out of our control. If there is another violation, the fines go up and the suspensions get longer. That's how it is. That's what the state says, and there's nothing we can do about it. So
Right. Understand that.
I hope they have it now.
Well, thanks, Mr. Archer. We appreciate you coming in. And
I do have a question. I understand that the fine is the fine, and it's step by step of the state, and I have to pay that. And I wanted to do so. I was wondering if there'd be a possibility where I could make that into a donation to the fireman's fund or the policeman's fund, or something that possibly the board would recommend as
We're
a
actually-
donation.
We're actually
to the community.
establishing a revolving health fund.
Okay.
And the other folks that have paid their fine, we're working with the town administrator to make sure those funds get into the revolving health fund.
Okay. Very good. Then the other thing, I know you just took an approach about the days that I would lose the license for. Is that something that would occur with me in this situation? Is there anything we can do to relieve the 3 days?
I don't know if there's relief from that, especially because we just made the motion and took the vote on it.
So I
I
could have
feel-
spoke before that went into place, but
Yeah, I'm not certain on the legality of all that. But I feel like, at least it's not 7.
okay.
I
There's
think
a
if we lengthened
technicality.
it, I would have honored the letter that was actually sent to you from the Tobacco Control Alliance, which calls out the 3-day.
Well, there was technicality in here. It says that I was suspended for a period of 3 consecutive business days, beginning on Monday, July 15th through Sunday, July 17th, 2022. So it told me I have 3 days suspension, but I have a week. And that was July 15th to July 17th, prior to me receiving this letter. So it's like I already had the suspension, but I didn't receive the letter.
And that's fine. As soon as you appeal, that's put on hold anyways. So you weren't expected to suspend sales during that time period.
Right.
Now that you come here, now we will make a motion to say what should the suspension look like, and then we'll set dates accordingly.
Okay. So when I saw that, it did say the 7 days, but in reality, it's not Monday through Sunday. It was 3 days. And I talked to Ms. Hamill about that, and she goes, "You actually have an error in your letter. You should let us know about that when it comes up."
Yes,
Just-
that
just
I'm
on-
looking at it. That appears to be a typo because the dates were correct, but it says Monday instead of Friday. Yeah.
Right.
Sorry about that.
So do we need a motion here?
We do.
And is that to just solidify the suspension window?
Correct. We've heard Mr. Archer's appeal and what he's had to say, and thank you for your work. I agree. I would still say I would make a motion to, we have no choice on the fine, but to impose the 3 consecutive business day suspension. Starting on August 26th and running through August 28th. That's a Friday, Saturday, Sunday at the end of the month.
Okay, that's it. I second.
Okay, we have a motion and a second. Roll call vote. Gino Fratelloni
Yes.
and Matt Wason,
Matt Wason, yes.
and Kevin Baker votes yes. Thank you very much, Mr. Archer. Let us know if you have any questions, and we will try and get better communication with the Leominster Tobacco Alliance and keep you posted if anything comes up that's pertinent.
Okay. Thank you.
Thank you, guys.
Have a good day.
Next, we have a 7:20 public hearing regarding the potential regulation requiring treatment for a student's disposal system within 100 feet of wetlands. I had spoken to, at our last meeting, Ted Doucette joined us and was kind enough to give some feedback on the language. So I had some communication with Mr. Doucette following our meeting, and he had given the description of the wetland as well as the secondary treatment standards. And he stated them as described in section 310 CMR 15.202 of Title V. So that would be the secondary treatment standards. And then he came up with a wetland citation from MGL, but I actually asked Amy Green, the head of the conservation agent. I guess that's her title. And she had suggested the verbiage that was a part of our agenda: 100 feet of a bank or bordering vegetated wetland, BVW, defined by 310 CMR 10.54 and 10.55. So that seemed to cover the bases of all the points that Kevin Davis and Dan Kane had at our meeting. Matt, Gino, I don't know if you have any thoughts, if you feel like this language is missing anything, if you feel like this is something we should continue until we have a full board here to discuss it.
I think, yeah, we should continue until we have the full board, but the question is, sometime, you know what I mean, the 100 feet, I understand that, but there is always what would you say, instead of the 100 will be maybe, 75 or 80 away from the wetland.
Right.
Because you never know, all depends on.
Like we said last meeting, if someone is trying to fit a septic system in and they need to come before us to grant a variance and they have a hardship, we'll take a look at every situation independently. Right. And as it stands on its own, this regulation is put in place so that we don't get ourselves in trouble by allowing something in one place and not allowing it another place.
Right. But the question is not like physically it's supposed to be 100 feet away from the wetland.
50
like
feet.
You say, all
Title V says 50 feet. We're not asking them to be away. We're just asking them to make the effluent cleaner as it gets closer.
Right. Yeah. That's it. I agree with it.
I mean, I don't think we're going to do much better and appease more people with that regulation with different language. I think Dan and Kevin would be in support of this, but I'm fine to continue it and push it to the next meeting if you all agree, decide that.
I like the improvement. Thank you very much for working with Ted to kind of get something that's a little more concrete. That's what I was worried about. Is it just, if there's nothing we can point to, it makes it hard. I agree. I think Dan and Kevin would probably support this, but I would say let's just push it until we have full representation,
full board,
so that they have their chance in case there's additional feedback. Let's make sure before the next meeting when we do vote on it, could you prompt everybody to go look at that section 15.202 so that we actually understand what that secondary treatment standards, what those are. And
I'll include those two items, both of those references in the packet for next meeting. So everybody should have time to read them.
Perfect.
So a motion to continue by one of you would be fantastic.
Motion to continue.
I second.
All right, roll call vote. Gino Fratelloni.
Ferroni, yes.
Matt Wason.
Matt Wason, yes.
And Kevin Baker votes yes. 7:30 ID decision support tool. Matt, do you have any new info to share?
You betcha.
There you go.
So here's our latest COVID picture. BA.5 is the absolute predominant variant that we're working with. There's BA.4, kind of relatively unknown. It's kind of popped up. It's less than 10%, but that's kind of the number 2 now. I think of note from what I'm seeing and hearing from people, BA.5 is definitely seemingly to cause more of an illness than prior variants, especially 2 and 2.12.1. A lot of people kind of talked about that really not affecting them very much, but BA.5 appears to be affecting fully vaccinated people and still knocking them down for several days with illness. So it's something to look out for. And right here on the right side, our 2-week case counts, again, knowing that these case counts far undershoot what is actually out there because it does not take into account home tests. those numbers are on the rise again. The home test kits are also, I'm hearing a lot of variation in what people see, potentially not testing positive for several days after they've had symptoms, which is concerning. Because I think what I don't want people to do is they have symptoms, they test, it's negative, and they say, I don't have COVID, I'm fine, I'll get over it. That is a concerning scenario. So I would strongly encourage people to keep testing through their symptomatic period. I know the CDC kind of throws out that, oh, test when you have symptoms. But man, please don't trust a negative test early in the course of the illness. You're still contagious at that point in time. And so if you say, well, it must be some other cold, if you're out in the community, it could still be causing a problem. So if you're not going to test, please at least follow isolation requirements as if you did have COVID. Wear your well-fitting masks if you have to go out in public, and try to be careful with your own family members in your household. Beyond that, our kind of metrics are still all sitting in that yellow range. ICU bed access is mid 80%. The CDC still puts us at a medium level for concern. The up-to-date vaccination data, that's pretty old, but we know that our boosters are okay for the middle age groups, great for the upper age groups, and then not a lot in the remainder of this because we don't have the school data. And then the wastewater data is kind of just middling. It's in the kind of 400s to 800 ranges. It's, lower this week, but it's still above that kind of 200 threshold where I feel like we really see the cases drop. So I know it's old news, but COVID is out there. It's still spreading through our community and the communities around us. And with school coming up soon, it's not going to go away.
Agreed. Yeah, I feel like we are probably due for a COVID update with Katrina towards the end of the summer, beginning of fall. I'll try and get her availability, see if she can join us for a meeting. In regards to the testing, well, I guess we'll discuss that during administrative matters, but and I wish Jim was here. I had a question for him on that too. I did communicate with Anthony regarding the Vax bus coming back to Littleton sometime in early September, hoping to combine that with a COVID test distribution location / event that we can potentially host in September, but I need more information from him on that too. Any final thoughts on the current COVID situation?
Like I said, it's not going away, and I think my concern is that each new variant seems to be getting harder and harder to manage. It's more transmissible, less responsive to vaccination. Vaccinations are still helping keep people out of the hospital and keep people from serious illness, but we're still in this window where I think there's a tolerance and an attitude that it's pretty much okay. You don't have to worry about it too much. I think in the community, mask wearing is down a lot since the spring and the winter for sure. But again, numbers are going up. BA5 is going to knock you down if you get it. You're going to be out of work for several days and putting your family members at greater risk. So pretty please wear your masks out in public when you can. When people get back to school, I'm concerned about higher transmission rates.
Mm-hmm. Maybe we should, did you have a chance to take a look at the communication column on the chart, the guide that we had set out to discuss with the select board in regards to the types of communication to be done?
Sorry, I did not do that.
That's okay. I don't want that to fall through the cracks, because I feel like it's going to be like something that when we need it, we're going to need it like right away.
Yeah, let me, I have it on my to-do list. I just didn't have it. It's not checked off. So
right.
Can you put it on the agenda for next week for our board to review that plan together? Thank you.
Mr. Chairman, can I say something?
Yes, please.
Okay, now, in September, the children are coming back to school, am I correct?
Yep, September 7th.
Wouldn't it be better if everyone should be tested?
Yes. So everyone should be tested, especially, if they're coming back from, out of town, seeing lots of different people, have symptoms.
Right,
We have
yes.
some tests. I spoke with Dr. Clinchey, and I'm assuming we'll talk more about this with them at our joint meeting on August 25th, which we'll go over later. But they have some tests. They certainly they have just about 2,000 staff and students. They will need more tests, and we will work together as a board with their board. And potentially other groups in town to make sure they have the tests necessary to keep everybody safe and healthy.
Yeah,
Stop the spread.
and also, all those children, they have all the 3 vaccine, like the flu, and then the first one, and the second one,
They have the opportunity to have it.
and also the
Right,
booster.
our
I don't know.
vaccination rates for that age group are really good for the first 2 shots. But that booster, last time we saw that data, the first booster for that age group was a much lower penetration percentage.
So
What about
that's the intent of bringing the bus there, to get them boosted.
Yeah.
Get all the kids boosted.
And yeah, as I said that last meeting, I think we also have to balance the availability of new vaccines that are on the horizon that are hopefully going to be coming out and approved in September. The bivalent vaccine that could do a much better job with covering the newer variants.
Yeah,
So I think we have to balance kind of how long do we wait for that new one to come out, and not press too much on the next booster, because that'll replace the booster effectively. Love to have it before school starts, but I don't think that's going to happen.
Right.
we're just very, very concerned about the children, you know what I mean? That's all we need,
All right. Well, we'll continue to discuss this. We will revisit this at our next meeting, which I don't have a calendar in front of me, but I'm assuming it's August 24th.
I thought it was supposed to be the 28th. Wasn't it supposed to be the 28th of August?
So that was a typo. We're going to do the Board of Health meeting August 24th and the school committee joint meeting August 25th. It's a Thursday. That one's going to be virtual or hybrid, because some of the school committee members will still be on vacation. So we'll get it all set up for Zoom so everybody can attend.
Okay. Make sure I get the information and the email, okay?
Yep. So we'll move on to our 7:40. We have a public hearing regarding the memorandum.
Mr. Chairman, before we move on,
Go ahead.
I would also, while we're talking about infectious disease, bring up the monkeypox
Yes.
and the update. It has been posted to the Littleton Board of Health webpage. The information from the state of Massachusetts has 36 confirmed cases. Please be aware, please look online if you're concerned about it. Monkeypox has a much more specific method of spread that requires much more contact. So it's not going to be something that you're going to catch at the grocery store like COVID. But the difference is that monkeypox typically has a very prototypical rash and symptoms. But what we're finding is that this version of monkeypox that has cropped up is actually not necessarily producing a rash. So please, if you get symptoms, and unfortunately the symptoms are very common things like I have a fever and I don't feel good and I have muscle aches and I have a headache and I have a cough, right? That could be COVID. It could be anything else. But if you're concerned, please read about monkeypox online. Get information so that you know if you're at higher risk. And if you're at higher risk, please have your eyes open to that potential. Please contact your care provider. And please also, if you're in a high risk situation and work-related situation, vaccines are available. They're limited, but they are available if you're considered high enough risk. So monkeypox is out there. I don't think we need to be alarmed, but please, if you're in one of those buckets, keep an eye out for it and try to take care of yourself.
Thank you very much.
Thank you, thank you.
So we'll move on to our 7:40 public hearing regarding the memorandum of understanding between the select board and the Littleton Board of Health. Matt Wason and I had attended a small meeting with town administrator and Mark Rambacher of the select board to go over the document. We took away some things, we added some things, and we spoke with town council. And what we came up with in the long run was the document you see in the packet before you. I am 100% okay with approving this and moving forward so we can get our position for the public health coordinator. Got things moving on that. I know it's been, it's likely going to get reposted with some different information very shortly. So we need to approve this agreement and get it in front of the select board so they can approve it. Matt, do you have anything to add to that?
I was just double checking to make sure this version is the last one that I saw. Because does it have the updates that Tom provided? That I just want to make sure it has that. Let me check. I got it right here. Okay. Yes, it looked like, sorry, they all changed to red. So I wanted to make sure the track change actually included the updates from that. So yes, good meeting. I think we came up with a document that meets our needs and is going to make sure the town has what it needs to help us out here. I think my only call out now would be to remove the gender specificity called out in section 3.A, because our town administrator is not necessarily a male or somebody who goes by his pronoun.
Okay.
But other than that, I'm happy to approve it.
3.A, you said?
Yep, section 3, section A, number 3, section A.
What does it represent, those numbers?
It just refers to town administrator as a he, when it could be any gender down the road moving forward. You know, we can't tell the future who's going to be there. So we just want to leave it open.
Yeah, everywhere else it says town administrator / designee. So we just need that one little edit made, and
okay,
I think that's fine.
So a motion to approve with an edit to the reference to gender in section 3, not in number 3, section A.
I so make a motion.
Great. Do we have a second? A second.
Oh, boy.
Gino
I wish
Ferraloni.
the other two gentlemen to make the second. I seem like I hesitate to say yes, but let's try it. We have a long way to go.
Yep.
Okay, I'll make a second.
Okay. Roll call vote. Gino Fredoloni.
Yes.
Matt Wason.
Matt Wason, yes.
And Kevin Baker votes yes.
Awesome. That's been a lot of work. We got it done.
Work, yeah. Let's see. We don't have any minutes to look at right now.
On that note, I forgot to look it up again. Aren't we required to get those posted in a certain amount of time?
30 days from the date of the meeting.
Okay. So before Brenda came on board, Kevin Davis, I think, still has 2 meetings.
I can check with Kevin on the minutes, see where he's at with those. If he hasn't done them, Brenda can just do them. And then get them up.
I don't believe that's valid. I believe at a prior meeting, you might not have been there. It was called out that the minutes must be produced by somebody who attended the meeting, not via transcript later.
Oh, I didn't know that. Okay.
So check before
I
you
will.
pass that one on. That came up in conversation. It might have even been like a post-meeting conversation.
Right.
But they have very strict rules, like we couldn't just use the transcript.
Okay. Do you know the 2 dates Kevin Davis has? It's okay if you don't. I'll find them.
No, not off the top of my head.
Okay.
I mean, we don't have minutes posted on the website since March 9th.
Wow.
And so Dan had a couple that I thought we got approved that might not have been uploaded.
Well, there was no one to upload them, right?
Right. I know we approved some that Dan produced.
Yep.
So I know we're better off than March 9th, but we should, if you want, I can connect with Brenda if you want me to follow up on it.
Yeah, I'll send an email out to Kevin and Dan and Brenda, and we'll just all get on the same page with the minutes and who has what and what's been approved, what hasn't been approved, and get them up on the website. We'll take a vote next meeting on a bunch of them.
Thank you.
Regarding the test distribution, all of the test kits that we have received, Jim told me there were 11 boxes. I need to contact Jim because I thought we were getting more boxes of tests. But we have 11 that have been stickered with the appropriate information. And so we need to send a letter out to all town departments and boards. I'm going to have Brenda put that on letterhead when she's back, get it over to Diane Corey to send out to all towns and boards. Chief Bernard has agreed to have the Littleton Police Department be the 24/7, the dispatch at the Littleton Police Department be the 24/7 community pickup location if needed. And I did speak with the folks at Parks and Rec who have some extra tests. They have about 400 tests that will be left over, I think, and I need to have a conversation about that with them to see if they're willing to part with those or a portion of those in an effort to get more over to the schools. Because I feel like that's where we're going to run short when this whole thing gets going.
Yeah, I thought when I had in my head that we were going to get just over 2,000 when Jim told us how much we were getting. So I agree. 11 boxes. When I heard that more recently, I thought that was much less.
Yeah, I think it's 1,800. We were approved for 1,800, somewhere around 1,800 boxes of tests. Yes. So 3,200 tests.
Oh, okay. Oh, yeah.
So that's way more than I think what we received.
We have less than 1,000.
Right.
Yeah.
Because there's 90 in each box, right?
That's what you said.
Yeah. So we'll speak with Jim about that. But I wanted to put on the radar because I get emails from Liz at EHS regarding the broadcaster. It's a print publication that they put out, and they have deadlines for when they put information out. And the deadline is always the day, like the morning of the day we meet. So I want to put on the radar the early September deadline, where we have the potential to have some communication with the community regarding public health matters. I will get by our next meeting the specs for how big of an area we can put information in. Is it just text? Is it an image? What we can do? And we'll bring that to the next meeting and make some decisions on what we want to put in there, because we should put something in there.
I agree.
We have an 8 o'clock discussion regarding the health department and long-term goals. I think we should probably continue that till our next meeting because Kevin and Dan aren't here. But my takeaway from our last meeting is that really the thing that needs to happen is a needs assessment for the town, so we can create a blueprint and a map for really what our goals are going to be. And I had reached out to Dan right before he went on vacation to see if he could quarterback that needs assessment. I know he's in the medical field and, probably know some folks around, UMass and things like that. Matt, Gino, if you have any contacts or connections for folks that might be able to help us get that needs assessment done, certainly let me know, and we can try and see what we need to do on our end to get that ball rolling.
Okay.
Other than that, so we got the MOU done. Long-term goals, we're going to continue. Unless Matt or Gino, you have anything to add to the health department long-term goals that we're working on?
Well, we'll see when we are all together, and then you go right over.
Yeah, we should probably do a retreat
Okay.
sometime and get all together in a room and a big whiteboard and have,
Right,
you know.
right.
Yeah, Kevin Davis brought that up. I agree. It's fine if we have this on the agenda every single time, but I feel like towards the end of the meeting, we're just going to kind of burn through it pretty quickly, and
Yeah,
we need to kind of catalyze it with something bigger. So whether it's another meeting that we have or a session where, it's a brainstorming and we start putting stuff out there and then start working on some prioritization. I agree. A needs assessment is absolutely critical for us to get done long before next July, when we have a planned departure from the Neshoba. Other things we come up with might be nice to haves that we can push out further, but we have a lot of work just specifically with kind of launching our health department for sure.
Yep.
so we discussed minutes and COVID-19 test distribution, and so the joint meeting is confirmed for August 25th with the school committee. No correspondence except that letter to the select board that was in the
Pardon
packet.
me. Do we
Yeah.
have a time yet on that meeting?
I'm assuming it'll be a 6:30 or 7. I'll confirm that.
Okay. Or when we would be on their agenda if it's not at the start.
We'll get on early. I think this is a special meeting. It's only for us.
Oh, okay.
They're coming together just to get on the same
What day
page.
is going to be? What
August
day it's
25th
gonna
is
be?
a Thursday. 8/25 is a Thursday.
Okay, beautiful, Thursday, all right. Good.
So if there aren't any other board member comments or updates, any public input, any hands raised in the audience?
No attendees.
No, great,
No ends, no ends.
perfect. So without anything else, if there's no comments or updates from other board members, we'll entertain a motion to adjourn.
Okay, I'll make a motion to adjourn, and I hope you guys are taking care of yourself, so don't get sick. Stay awake, wash your hands, and let's see what happens.
I have nothing else to add today, so I'll second.
All right, roll call vote. Gina Fratelloni,
Jennifer, only yes.
Matt Wason,
Now, Wason, yes.
and Kevin Baker votes yes. Thank you guys. Have a nice night. Thanks, Dave. We'll see you in a couple weeks.
You too, thank you, thank you.
Thank you all.